Hey guys, it's me Kumari Bhavna, and I'm going to make a video of sequel of case presentation of RTA. And in this video, I'll be discussing about the indications of splenectomy, the outcomes of splenectomy, the OPSI, the causes of OPSI, its clinical features, treatment, and prevention. So here we go. What are the indications of splenectomy? The most common is a trauma. The most common indication for elective splenectomy is ITP. Uh, what is the always indicated indication of splenectomy? It is primary splenic tumor and hereditary spherocytosis. What is the usually indicated indications of splenectomy? It is primary hypersplenism, chronic ITP, splenic vein thrombosis causing gastric varices, and splenic abscess. Sometimes indication for the splenectomy is splenic injury, autoimmune hemolytic disease, Hodgkin's disease, thrombotic thrombocytopenic purpura, idiopathic myelofibrosis, spleen artery aneurysm, Viscott-Ehlers syndrome, Gaucher's disease, and mastocytosis and aggressive disease. Rarely indicated in chronic leukemia, splenic lymphoma, macroglobulinemia, thalassemia major, sickle cell disease, and Felty syndrome. And also in hairy cell leukemia and sarcoidosis, it is rarely indicated. And in which diseases it is not indicated? It is not indicated in asymptomatic hypersplenism, splenomegaly with infection, splenomegaly associated with elevated IgM, hereditary hemolytic anemia of moderate degree, acute leukemia, and agranulocytosis. In these cases, splenectomy is not indicated. So what are the splenectomy outcomes? There is increased risk of infections and hematological outcomes. We are going to study two things about related to infections and related to hematology. So if splenectomy is done, what happens? There is increased risk of infections. How? There occurs loss of splenic macrophages, so and diminished tuftin production, so loss of spleen's RE screening function. So after splenectomy, ability to filter and phagocytose bacteria, particularly encapsulated bacteria like streptococcus, pneumonia, Haemophilus influenza, Neisseria meningitis, and parasite blood cells is lost. So there is increased risk of infection. So most common infection after splenectomy is streptococcus pneumonia. Other common bacterial infections which can occur is Haemophilus influenza type B, meningococcus group A and B, streptococcus. Protozoas that can invade RBCs is Babesia, Escherichia, and Plasmodium. Plasmodium species causes malaria. So we'll see it further about the correlation of splenectomy and Plasmodium and the treatment. Why do we give prophylactic treatment? So this is also the reason why we give prophylactic treatment in cases of splenectomy. After splenectomy, why we give prophylactic treatment for Plasmodium? We give anti-malarial drugs like Lumerex 80 tablet. So what to protect the patient from acquiring malaria? So what are the hematological outcomes? Immediately after splenectomy, leukocytosis, thrombocytosis occurs. Levels return to normal within 2 to 3 weeks. And what are the chronic manifestations? Anisocytosis and poikilocytosis occurs. Howell-Jolly bodies, nuclear remnants occurs. Haynes bodies, we get Haynes bodies denatured. Haynes bodies are denatured hemoglobin, basophilic stippling, and occasional nucleated erythrocytes. So what are the complications of splenectomy? The pulmonary complications are, most common complication is left lower lobe atelectasis, pleural effusion हो जाएगा और pneumonia. Hemorrhagic complications में subphrenic hematoma, infectious complications में subphrenic abscess और wound infection हो जाएगा. Pancreatic complications में pancreatitis, pseudocyst, pancreatic fistula. Thromboembolic complications में DVT and portal vein thrombosis. अब हम लोग पढ़ेंगे ऑप्सी के बारे में. ऑप्सी होता क्या है? Overwhelming post splenectomy infections. The most common fatal late complications of splenectomy is OPSI. Mortality associated with OPSI is 40 to 50%. Infections may occur at any time after splenectomy. Lifelong risk remains. Most infections occur more than 2 years after splenectomy, usually after 5 years of splenectomy. रिस्क क्या होता है? ग्रेटेस्ट होता है थैलेसेमिया मेजर में एंड सिकल सेल एनीमिया में ऑप्सी होने का. मोस्ट सीरियस सीक्वल इन ऑप्सी क्या होता है? मेनिंजाइटिस, निमोनिया और बैक्टीरियमिया. इट इज टिपिकली कॉज्ड बाय पॉलीसेक्राइड एनकैप्सुलेटेड ऑर्गेनिज्म such as Streptococcus pneumonia, Neisseria meningitis, and Haemophilus influenza. That's why after splenectomy in that patient, prevention of apopsy, vaccines were given to protect the patient from developing opsy. So in case of elective splenectomy, vaccination should be given at least 2 weeks before surgery, and in case of emergency splenectomy, vaccination should be given as soon as possible following surgery. What are the clinical features that we get in opsy? Opsy typically begins with prodromal phase, and prodromal phase comprises of fever, chills, and rigor, and other non-specific symptoms. So like sore throat, malaise, myalgia, diarrhea, and vomiting. प्रोग्रेशन ऑफ इलनेस क्या होता है? रैपिड होता है विद डेवलपमेंट ऑफ हाइपोटेंशन, DIC, रेस्पिरेटरी डिस्ट्रेस, कोमा, एंड डेथ विद इन आवर्स ऑफ प्रेजेंटेशन. डिस्पाइट एंटीबायोटिक्स एंड इंटेंसिव केयर, द मोर्टिलिटी रेट क्या होता है? 50 to 70% होता है फॉर फ्लोरिड ऑप्सी. Most frequently involved organism in OPSI is Streptococcus pneumonia, 50 to 90% of cases. Other organisms involved in OPSI are Haemophilus influenza, Neisseria meningitis, Streptococcus and Salmonella species. रिस्क फॉर ऑप्सी क्या होता है? ग्रेटर होता है इन स्प्लेनेक्टोमी फॉर मेलिग्नेंसी, हिमेटोलॉजी कंडीशंस देन फॉर दोज हु अंडरवेंट स्प्लेनेक्टोमी फॉर ट्रॉमा. रिस्क क्या होता है? ग्रेटर होता है फॉर यंग चिल्ड्रन दैट इज लेस देन 4 years of age. Patients who survived after OPSI with therapy may develop residual problems like gangrene of limbs, stiffness, meningitis, mastoid osteomyelitis, heart valve destructions. अब इसमें ट्रीटमेंट क्या देंगे? ट्रीटमेंट में एंटीबायोटिक्स देंगे लाइक सीफोपेराजोन, सेफ्टासिटाम एंड अमीकासिन. वेंटिलेटरी सपोर्ट में आईसीयू केयर करेंगे और ब्लड ट्रांसफ्यूजन भी करते हैं इसमें. फिर इम्यूनोग्लोबुलिन का ट्रांसफ्यूजन करते हैं. देन TPN एंड में टोटल पेरेंटल न्यूट्रिशन एंड मेंटेनेंस ऑफ यूरिन आउटपुट. सो हाउ आर वी गोइंग टू प्रिवेंट OPSI? So for prevention of OPSI, vaccines should be given for Streptococcus pneumonia, that is PPV 23. It is included in NIS, National Immunization Schedule. Revaccination is done once in 5 years. Depending on the decline of pneumococcal antibody level of the body, revaccination is required. Booster injection of pneumococcal vaccine should be given 5 to 6 years. Haemophilus influenza type B. Vaccination is given to prevent OPSI. That is, it comes in the name of Influvac Tetra, and the number of doses is 2 doses, and schedule for it is 0 and 1 month. And third vaccine is meningococcal, and it is given to high risk groups, and it comes in the name of Menectra, and 3 doses is given 0, 1 and 6 month. In malaria endemic areas, anti-malaria prophylaxis is given as we discussed earlier. For example, Numerex 80 tablet, artemether and lumefantrine is given. Vaccine is best avoided during pregnancy. Lifelong prophylaxis of using benzathine penicillin using 12 to 24 lakh units is controversial in adults. Harrison बोलता है कि routine chemoprophylaxis with oral penicillin can result in emergence of drug-resistant strains and is not recommended. In the next video, I'll be discussing about anti-malarial drugs and the mechanism of actions. That's it. In this video, we discussed about the indications of splenectomy, what are the splenectomy outcomes, the complications of splenectomy, the OPSI, its clinical features, treatment and prevention. That's it. Thank you.